The Ohio State Heart and Vascular Center is where groundbreaking research is paving the way for unmatched patient care. Our team at the Dorothy M. Davis Heart and Lung Research Institute is tackling some of the most pressing and complex issues involving the heart. We are working to help patients with irregular heartbeats.
Cardiac disease is the #1 killer in the United States, and it's responsible for hundreds of thousands of deaths each year. In many of those cases, the immediate cause of death is a disturbance in the normal electrical rhythm of the heart, also known as an arrhythmia. And so the ultimate goal of my lab is to help prevent these arrhythmias in human patients.
We are making more successful transplants possible.
We've developed a multi-organ assessment repair center through the Comprehensive Transplant Center over the last 7 years. And it really is the quintessential bench to bedside model. So we developed a research platform that has now translated into the clinic, where we're using the same perfusion technologies, where we're assessing organs and trying to make them better for transplant.
We are finding ways to prevent heart attacks.
The hope for this research is really to identify risk factors that people might have for atherosclerosis or for developing a heart attack, and be able to predict those patients who might need increased therapy or alternative therapy that we hopefully could develop to help prevent them from having development of atherosclerosis or have a heart attack, and then the sequelae that happens after a heart attack and the development of heart failure.
We are helping save the hearts of cancer patients.
People are well aware of the issues with cancer and the high morbidity and mortality, but what a lot of people don't realize is that for cancer survivors, heart disease is actually the #1 cause of death. So our group is really interested in trying to understand why and how can we make an impact and how can we reduce the cardiovascular mortality in cancer survivors.
And we are doing groundbreaking work in genetics.
My research is focusing on molecular mechanisms of arrhythmias. What we are particularly interested in is when thinking of arrhythmias, you can have the ones that are caused by genetic mutations in different genes that will cause the arrhythmias. And then there's obviously the arrhythmias that develop over the years, maybe because you have heart failure or atrial fibrillation and things like that. One of my particular interests is really the genetic forms of arrhythmia.
Our growing team of researchers is working together to make more breakthroughs happen.
We couldn't have done it anywhere other than Ohio State with the vast network of collaborators and resources we have there.
I tell this to everybody, the thing that's most unique about Ohio State of all the places I've been is really the people. So there's great infrastructure here, everything is consolidated on one campus, but it's really the people. So from the house staff and the nursing in the hospital to people in our laboratories, everybody's very collaborative and very open.
As I've been looking at position in the last year, it was always interesting because places I was looking at, they kept telling me how everyone they wanted to recruit was being recruited by Ohio State.
Now we're taking our talents, merging them together and working in unison to try to identify and solve these problems while simultaneously delivering the best care to our patients who have these unique problems.
It's all happening at the Ohio State Heart and Vascular Center.